Our 1,367th death is a 92-year-old female from Mason County. Our 1,368th death is a 71-year-old female from Ohio County. Our 1,369th death is a 77-year-old male from Mason County. Our 1,370th death is an 86-year-old male from Kanawha County. Our 1,371st death, another real young person, is a 49-year-old male from Upshur County. Our 1,372nd death is an 81-year-old male from Raleigh County. Our 1,372nd death is a 58-year-old male from Marion County. Our 1,374th death is a 78-year-old female from Wood County. Our 1,375th death is an 85-year-old female from Wood County. Our 1,376th death is an 87-year-old female from Wood County. Our 1,377th death is a 97-year-old female from Cabell County. Our 1,378th death is a 58-year-old female from Cabell County. Our 1,379th death is a 78-year-old female from Greenbrier County. Our 1,380th death is a 63-year-old male from Pleasants County. Our 1,381st death is an 83-year-old female from Wood County. Our 1,382nd death is an 83-year-old male from Jackson County. Our 1,383rd death is a 77-year-old female from Barber County. Our 1,384th death is a 70-year-old male from Barber County. Our 1,385th death is a 28-year-old male from Grant County. Our 1,386th death is a 67-year-old male from Hancock County. Our 1,387th death is a 73-year-old male from Roane County. Our 1,388th death is a 69-year-old male from Cabell County. Our 1,389th death is an 85-year-old female from Jackson County. Our 1,390th death is an 88-year-old male from Harrison County. Our 1,391st death is a 91-year-old male from Monongahela County. Our 1,392nd death is a 66-year-old male from Brooke County. Our 1,393rd death is an 83-year-old female from Wood County. Our 1,394th death is a 67-year-old female from Wyoming County. Our 1,395th death is a 77-year-old male from Jefferson County. Our 1,396th death in West Virginia is a 54-year-old female from Brooke County. That's tough stuff. That's all there is to it. You know, and please just don't let them become a number. I mean, please don't let them become a number. In addition to this, we've lost a correctional officer. A veteran officer with the West Virginia Division of Corrections and Rehabilitation died Saturday while under treatment for COVID. Corporal Mark Rustenmeyer, who is 58 years old, has served at the St. Mary's Correctional Center in Pleasants County since 1998. 58 years old. You know, the corporal's death is the first of a West Virginia correctional employee attributed to COVID. That's quite an astounding accomplishment, to tell you the truth, that corrections have done. But absolutely, again, in addition to that, I truly wish you would keep this great person, this great man, in your thoughts and prayers. At DHS, we have lost an individual there as well. This terrible disease has taken another dedicated public servant. Captain Chuck Sadler died on December the 30th. Captain Sadler performed a crucial role for all law enforcement in West Virginia. He oversaw the training and certification of the state's law enforcement professional standards. Before that, he served 24 years on the Charleston Police Department and retired there as a captain. Captain Sadler was a U.S. Army veteran and a devoted husband, father, and grandfather. His faith and family were the most important in this man's life, and that's how it should be. He also earned the respect of countless West Virginians, including thousands of our law enforcement community. Again, a great man that will really be missed. Okay, in regard to our numbers are skewed a little bit because we did not test very many. You know, we only tested, and let me find the number here real quickly, but I had the number. 6,000 West Virginians is what we tested in the last 24 hours. Our positivity rating on that 6,000 was 13.81%. Our cumulative number now has gone over 5% at 5.07. We have 27,000 active cases and 63,000 that have recovered. We have 799 patients hospitalized and 205 in the ICU units. Our reproduction RT number is at 1.02. It's gone down a pretty good little bit. That's the 39th best in the country. You know, we have 54 counties now in the orange and the red. Again, I go back to telling the people just this over and over and over, but if you happen to be 65 years of age and older, you have got to absolutely move quickly if you get any level of sickness. I mean, this thing is terrible. The antibodies will absolutely save your life. You have absolutely got to move if you feel any level of sickness and get a test. And if it comes back positive, and then we can move quickly with the antibodies and everything and probably save your life. Now, as of today, in the state of West Virginia, we've put these together, and we need to separate them. We've received in the state of West Virginia, I think this number is correct, but around 87,000 total doses of vaccine for our first shot. We are now coming up on an anniversary where people are now getting a second shot. And we've received 16,000 in order to be able to vaccinate on time for the second shot. Well, we put them all together. And they need to be separated because really and truly, the second shot doesn't have anything to do with how fast we're getting them in people's arms. Naturally, we got to do the second shot, but we shouldn't really get credit for it, nor should we be penalized and everything for where we are. But our current vaccine administration rate is at 43.61. We dropped a good ways down and everything as far as we're still the fifth or something like that in the nation. But if you really just think we've put in arms 52,000, and we have a total number of vaccines that have come into our state of 103,000, that's what comes to these kind of numbers and everything. And I don't really know how they've done that math, because it seems like to me that math really should be more like 47%. But nevertheless, this is what I got here, and I'm going over with you. But nevertheless, I believe if we've put in arms 52,000 today out of 87,000, that's a different animal. That's a different percentage, a significantly different percentage. It's probably more like 60% rather than this number here, because we're going to have to do the follow-up on the second doses anyway. I don't think that they matter, in regard to the number of people who are getting vaccinated, especially for the first time. Now, as far as our vaccines that are going out to our K through 12 and staff and the service personnel and all those that are of age 50 and above, and I'm just not going to look at my notes. I'm just going to talk to you now. Here's the thing. We're trying to get set up, and then we're going to get set up, and we'll be orderly, and that'll all be really good. I'm going to push that we get set up faster. because we need to get through and get all of our teaching community, and our service personnel tested, and I mean vaccinated now for those that want the vaccine, and I hope 100% of them come, because it is just that important now. And so we're moving on that and moving right along. Last Wednesday was a tremendously important day. I don't know that it got reported by the media, to anywhere close to the level of what was done on last Wednesday. But if you'll just think, you'll step back from it, there had to be major, major decisions that were made. The first decision was just this: we were almost through, for all practical purposes, the Christmas holiday, and what are we going to do about going back to school? All the health community and all the education community tells me that from the standpoint of our kids not being in school, they're hurting really bad. A third of them are failing a core class. Many of them, we know that there's all kinds of abuse and bad things happening to kids out there. And our call lines and everything that we have set up and all that have absolutely gotten terribly quiet, because we don't have eyes on these kids. We don't have any way to help these kids. That's terrible. That's just plain terrible. In addition to that, we've got all kinds of special needs areas and so on where we could be helping. And the bottom line to the entire thing is the virtual concept is better than nothing. And really and truly, if you happen to have parents that are home, that are able to sit there and really work with you and really work hard with you and everything, absolutely, I guess it's a better replacement than nothing. But when it really boils right down to it, the virtual concept does not replace the in-person situation that you have with a teacher and how you interact in the classroom. So that day, that Wednesday, we decided we're going to go back to school. And in addition to that day, we decided not only are we going to go back to school, but we're going on our older kids that transmit this thing more so than the younger kids. It's almost non-existent with the younger kids. What we're going to do is we're going to go with our map, and we're going to try as hard as we can to get those kids back in school as well as soon as we can, but we know we can't do that right now. So we made a big decision. Let's go back to school. Now, in doing so, then we took another step, and we said, to make this thing even safer for our teachers, our service personnel, and all those, we're going to move as quickly as we possibly can to get them vaccinated. We're going to start with the people over 50 because they're the ones that get sick, and especially the older ones, they're the ones that get sick. So we're going to get them vaccinated, and we're going to get them vaccinated as quick as we possibly can. Now, we know this too. We know that upon the first vaccination, within 7 to 10 days of the first vaccination, you've got some significant coverage that you didn't have before with no vaccination. And most generally, the health community will tell you that after 7 to 10 days of the first shot, you're cleared up to about 50% coverage. And so, in other words, you're significantly less likely to get this thing with the first shot. And the second shot is what moves you up to 95%. But what we did is we said it's horrendously important to get our kids in school. And in addition to that, it's horrendously important that we have our teachers and our service personnel and all of our community right with us. And we're going to move all of them up on the food chain, way up, and get them vaccinated right now. Now, in addition to that, the next thing we did is, what we did? And this is the thing that absolutely could have caught us for sure. Now, I pass all the credit in the world and all the accolades in the world to my health community and experts and the Guard and everybody, all over the place. I came up with this thought. This is nobody's thought but mine. And here's the whole deal. If we don't watch out, we're going to get caught in the situation to where we have vaccines sitting on the shelf, lots of them. And we have got to move now. This is last Wednesday. We've got to move right now to getting these vaccines in the arms of our people, even though we were first in the nation. I don't care we're first in the nation. I want to be first, and more first in the nation. We all know that absolutely every hour that goes by that somebody that's 70 or 80 years old that doesn't get this vaccine, somebody's going to die. So if our effort is to save lives, we got to move, and we got to move now. That's when we came up with the idea that we don't want a bunch of vaccines sitting on the shelf. We do not want that. I can't get more for you. I can't scream like the squeaky wheel to the federal government and get more for you if we've got warehouses full of vaccines. Now, and so I said we move. We move now, right now. We move now to get our teachers and service personnel done, and we move now towards trying to get our people that are over 80 years of age. Now, what did we do? We decided to go to school. We decided to put our teachers and our service personnel as top priority in everything to ensure their safety. We decided to not have a bunch of vaccines sitting on a shelf. And we decided to give hope, real hope, back to our people that were 80 or 70 years of age. Those people had been told over and over they would not be getting a vaccine until probably April. And absolutely, they were scared to death because they knew if they get this, they're in real trouble. Real trouble. We gave them hope. And in doing so, as of today, we have now vaccinated 8,300 of our people that are 80 years of age and older. Now, anybody can say anything they want to me, but I'll guarantee to you, we saved lives. We saved a pot full of lives right there. Now, the thing we got to do is we got to realize just this. We've got 87,000 doses and 16,000 that are the second shot, so that doesn't really matter. We got 87,000 doses, and we've got 37,000 of them that are sitting and they still aren't in arms, and they got to get in arms now. Because we're going to get more of them in this week, and we'll get more of them in arms and in arms now. Now, we'll be talking a whole lot more, with all my people today, and we'll come out with a schedule tomorrow as to where we're going to be as far as being able to vaccinate the teachers and the service personnel, and where we're going to be in regard to vaccinating the 80-year-olds plus. And the other things are just this, as you know from the standpoint of the elderly, to call your health clinic and see if they've got vaccines there, and that you can make an appointment and come down there and get your vaccine. Today, in order to help people with all this and everything, there's information, I guess, on our website. Let me see. We are announcing a new COVID vaccine info line. That should be up there right now. This line will operate Monday through Friday from 8 to 6 p.m. and Saturdays from 9 to 5. The number is 1-833-734-0965. It will serve as a point of reference for West Virginians seeking information on COVID and their vaccines and the timeliness and any other questions about the vaccines. We have a lot of information on the COVID website. Also, our partners use a whole variety of methods for getting this information out to you, like social media, radio, television, and newspapers. And so watch it all, but you'll have our hotline up there, and maybe that'll help some too. again, I tell you that over and over and over, if you've not, well, whether you've had it or not had it, your vaccine, your best ammo today is this mask, and you got to wear it. So please, let's don't drop our guard there. You cannot get, when you take this vaccine, you cannot get COVID from the vaccine. You're not going to grow antlers. You're not going to grow a third hand. I mean, for crying out loud, quit listening to these people that are running around with all these scare tactics and everything. All they're looking for is allies. They're looking for a platform, and they're looking for a bunch of people to agree and root them on. Literally, the science and all the medical field to the very best of everybody's knowledge. Everybody's knowledge, to the best of their knowledge. We can't say there's no risk to anything. You can't do that. But absolutely, to the best of all of our knowledge and everything, this vaccine is extremely safe. From the standpoint of the antibodies, I've told you if we can catch this, and we can catch it in the first 1 to 6 days when you have this virus and everything, we can probably save your life. We encourage the people, like I said, to go get tested. Treat this when you get feeling bad as if it's a heart attack or a stroke. It's just that important. All here tells us where you can get tested on our website. The drive-through pharmacy people, we really appreciate. Currently, there are 10 outbreaks in our schools. Of course, our schools aren't open for all practical purposes, and there's 118 outbreaks in our long-term care facilities. Our churches have 16 outbreaks in 12 counties. That's down a little bit. But those counties are Harrison, Greenbrier, Jackson, Marion, McDowell, Mingo, Monongalia, Nicholas, Raleigh, Summers, Upshur, and Wyoming counties. Again, if you decide you're going to go to church, especially if you're 60, well, anybody goes to church, let's please keep a pew in between you, keep a social distancing, wear your mask. Absolutely, if you're older, please think really hard about whether you should go or not. We have 601 active inmate cases now in our corrections. That's down by more than 70 from last week. The hot spot last week was been the Eastern Jail. There were more than 270 active cases there. There are now three. It's amazing what corrections is doing. There's 601 cases in the state. There's 253 at St. Mary's, 246 at Central Regional, 80 at Tigard Valley, and there's 54 staff members. Again, I tell you over and over about wearing your face mask. You got to do that. Your flu vaccines are still out there. You need to do that. Anybody that can get and give blood, please go do that. That's really, really, really important. For the most part, our revenue numbers came in December, and for the most part, we were flat. We were down $4.7 million. It's amazing, that the people were able to estimate this close. The good part about all this is year to date, on a surplus, from our budget, we're $127.2 million above our estimate for the year. That's 5.3% above our estimate for the year, $127.2 million. That's great. But in addition to that, we are trending now with a cash surplus of absolutely hundreds and hundreds of millions of dollars. But good work again by our economic people and everything, and I'm really proud of how we're doing in this state economically. We have an economic development announcement today coming for Jefferson County at 1:00, and I want you to stay tuned. And right after the briefing, we'll be bringing that up. And from the standpoint of our National Guard, we have a change of command also today at 2:00, and I will host the official change of command ceremony, which marks a transition from Major General Hoyer to Brigadier General Crane and Adjutant General General of the West Virginia National Guard. In November, I announced that General Hoyer would retire and take a new role at West Virginia University, and where he would be continuing to be part of the pandemic leadership team and as the director of the Joint Interagency Task Force overseeing the vaccine distribution. At that time, I also announced that I was appointing General Crane as our new adjutant general. Please forgive me for that, which becomes effective today. And I encourage all West Virginians to watch the ceremony. And the thing I want to do more than anything again is congratulate General Hoyer. I mean, you talk about a superstar. He has been such a superstar. It is unbelievable. I congratulate him on all of his service, and I absolutely want him to enjoy his family and all the goodness, but at the same time, he isn't going anywhere. That's the great part about it. He's going to be really, really helping us and dialed in with Hyperloop. And not only this, he's still right dead on top of all this vaccine and all the stuff, all the work we're doing here. He's going to hang right with us and be a resource like nobody's business. And I congratulate him and thank him more than you'll ever know. So thank you so much, General. And General Crane, we're really glad to have you. That's all I got.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good morning, and Governor, thank you for the confidence that you've had in me over the past 4 years as part of your leadership team. As the Governor said, today is the last day in uniform, but he wasn't going to let me go anywhere, and I didn't plan to go anywhere until the last vaccines are done down the road. So we will continue to be on that. Related to that, as many of you are aware, we had a break in the process last week that caused a challenge for us. I want to assure the folks, and Clay will talk a little bit more about this as well, that we have put process additional changes in place, that we have done additional training, that it is my responsibility to the Governor as the head of the Interagency Task Force to work with Dr. Marsh, Dr. Amjad, and Secretary Crouch to make sure that we continue to improve our ability to get vaccines out as quickly as possible without challenges. So we will continue to do that. I want to also point out to folks that, as the Governor pointed out, right now we will get this week 23,000 vaccines in the state of West Virginia. That is nowhere near what we need. So we continue to work with the Governor daily, and he continues to drive us and press us in the direction that we need to go to take care of the people of West Virginia and to stay focused on those principles of minimizing the loss of life, maintaining our health system, and getting our economy continuing to move forward. So we will continue to press that. Just to give you again an example of the dynamic nature of this, from the time the dashboard updated to that 52,200, we now have another 1,000 vaccines that have been reported to go into arms. So we continue to press this. Governor has pressed us to work additional ways to improve this process to get vaccines to people in the best manner possible. So you will hear more about several things this week. A number of sites across all 55 counties. We will have a site that will be working on the 50-year-old and older teacher and service personnel to get vaccines to those individuals. In addition to that, you will hear about some specific locations where the National Guard, local health departments, and our federally qualified health clinics will do clinic vaccine sites by appointment. We will continue to press as hard as we can in the appropriate manner to get things out. But again, I want to ensure folks that we will continue to improve our processes, and it'll be my responsibility to the Governor to make sure that I work with the folks on his leadership team to make sure that we get those things in place. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I want to re-emphasize a few points that the Governor made and that General Hoyer's made. Today, for some people, to be starting off second dose of the Pfizer vaccine is upon us. I certainly am enthusiastic about getting the second dose of the vaccine, as we know that the clinical trials for the Pfizer vaccine showed that 2 doses, 21 days apart, or for the Moderna vaccine, 2 doses, 28 days apart, was necessary to get the full protection from the vaccine. Now, some people may have read in the paper that people in the United Kingdom and officials there are taking a bit of a different approach, trying to get one vaccine in as many people as possible and not being as concerned about staying within that timeline of the second vaccine dose. And in fact, there's even been some thought in the UK about mixing the doses. I think it's important that, Dr. Fauci has said publicly, and I think this is true for most of our infectious disease experts and our medical community, is that we really want to stay very true to what the clinical trials and the emergency use authorization approval by the Food and Drug Administration instructs us. So I know that people in the UK are giving 1 dose and mixing perhaps the 2 different kinds of vaccines together. There has been some talk in the Operation Warp Speed about giving half a Moderna dose and then giving the second dose at a half level than the clinical trial showed. But what Dr. Fauci said, and certainly what we are adhering to very closely in West Virginia, which we believe is the best practice and the best protection for each one of our citizens who gets vaccinated, is to stay exactly true to what the clinical trials tell us. Full dose of the Pfizer vaccine, separated by 21 days, full second dose, full dose of the Moderna vaccine, separated by 28 days, full Moderna dose. And if we adhere to those, the clinical trials would tell us we have a 95% protection for people who get that. And there also seems to be a significant protection against severe disease or dying in the people that were immunized. So I think it's really important that we stick with the science, and as things change, we certainly will adapt, but we want to do that with the appropriate guidance from the appropriate authorities, the Food and Drug Administration and the Centers for Disease Control. It's also important that for people that are getting their second vaccine, there is the potential that you'll have an arm that's perhaps a little bit more sore than the first time that you get the vaccine. And some people can kind of feel not great, blah-y for about 24 hours or so. And that may be a little bit higher in commonality with the second dose of the vaccine. But remember, these vaccines are extremely safe. They cannot give you COVID. They cannot make you go sterile. They do not have the ability to create any other kind of substantial reaction other than the immune response, which they seem very good at getting, or in people who have had a really serious allergic response that uses epinephrine called anaphylaxis. You certainly want to make sure that you talk to your doctor, and if you've responded or reacted against any of the ingredients in either vaccine, then certainly that would be a reason to not take it until you talk to your physician. Or people that are acutely sick with COVID and are in isolation, we would ask them to wait until they get better from their acute illness. But otherwise, this is a very safe and very effective vaccine, and we hope that every West Virginian who has the opportunity will take it. Let me pivot for a second and talk about what General Hoyer mentioned, which was the issue that we experienced with our 44 people in Boone County at the local health department there. We know that as we move very quickly in this very, very complex environment, changing environment with COVID-19, and look at this complex vaccine distribution plan, we had talked a lot about starting to transition our plan from a more centralized plan where we're really focused on hospitals and nursing homes to a more decentralized group of people, citizens that live in the community. And we have, again, not done sequential necessarily, but overlapping priorities. And we were able, with the governor's focus, to get to the most highly vulnerable population, which is our over 80-year-old group, and then our 70 to 80-year-old group. As we push to get vaccine delivered to the places where we can immunize these highly vulnerable people and other people that are in our priority list at this point in the community. What we're aware of, just like in every medical circumstance, that the more handoffs you have with any process, the more likely you will experience issues with the process that you've set up. And we are really focused at every level to make sure that anytime that there is a break in our process, that we immediately assess what that is, make sure things are safe for people, as was done in this situation, and then constantly improve that process. So for the 44 people in Boone County, they were immunized with the Regeneron antibody, which was the antibody that was used to treat President Trump when he was infected with COVID. So it won't cause harm to these people. But we've immediately contacted 40 of those 44 people, and they've been revaccinated because we want to make sure that they get their vaccine. And the other 4 people are being actively contacted so that they can get their vaccine on a priority basis. And what we want to make sure of for each West Virginian, that you are aware of not only the complexity of what's going on, and I think the amazing leadership that General Hoyer and retired Colonel Joe Peel and the Joint Interagency Task Force have been doing, but also the fact that this process is constantly being improved and assessed. And as we find anything that we can do better, whether it's looking at the way that we're immunizing people, like Operation Warp Speed has indicated, that as I said before, we would wait for any guidance from the Food and Drug Administration or the Centers for Disease Control, or looking at the specific way that we're moving vaccine to different parts of West Virginia to be able to immunize our elderly. We will continue to make sure that that is safe and has the highest quality and the fastest speed for each West Virginian, because as the governor said, we realize that every vaccination may be a life saved. And at the same time we're doing this and trying to get that vaccine to each West Virginian in that priority basis that we've set up, it's really important to finally reemphasize what the governor said. Our greatest tool against COVID-19 right now is wearing your mask, staying physically distanced, doing the right thing. We know that we will expect to see a bit of a surge in the next 2 to 4 weeks in our country and in West Virginia from the recent holiday. So it's even more important today that not only we get vaccines in the arms of all people that we can, that is a great tool in our tool belt, but also to ask each one of you to use your power to reduce that transmission. So during this interim, between the time that we get people vaccinated and their immune system starts to respond, that we can protect people in West Virginia and also can protect our vital assets and save lives. Thank you very much.
All right, thank you, Dr. Marsh. Dr. Ayn Amjad, our state health officer, and Bill Crouch, secretary of the West Virginia DHHR, are also joining us today and are available for questions. We'll now go to media questions. Our first today is from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the questions. Because we've been gone a couple of days, a couple of things have cropped up, and I want to try to address them. I know we only get one shot, so here it is. On the vaccine doses, which were mistakenly distributed, how exactly did it happen? Where did that incorrect medication go? And how much responsibility rests with the local health departments to make sure, even if they get the wrong medicine, that they are putting the right medication into people's arms? So that'd be the first part of the question. The second question is, obviously, there was a photo that went viral nationally. It's received national coverage in the media about a gathering at the Greenbrier. Governor, I know you've answered questions about the Greenbrier before, and you've mentioned that you're not involved in day-to-day operations. But when you see a picture like that, what do you take away from it, and what can be done to correct those situations so they don't happen? And finally, you mentioned getting medication to those over 80. A lot of complaints that Kanawha County Prosecutor's Office and some magistrate clerks and other government officials, bureaucrats, and elected have been given priority vaccine doses under the cover of continuation of government services. Governor, you've said that each 80-year-old who doesn't get a dose of medication is in danger of dying. So is it safe to say that while you vaccinated thousands, if vaccines aren't available for those over 80 because they've gone to otherwise young and healthy people, that we're also responsible if any of those 80-year-olds die over the next couple of weeks. Thank you.
Okay, well, first of all, Kenny, you've got three questions, and I've forgotten the first question, but the three, did anybody from the health community? I thought that really from Dr. Maybe General Hoyer or somebody from the health community could answer the first question.
Governor, if you're okay, I'll take the one. Kenny, there was a break at 3 points in the process that we have since identified and are putting additional training and an additional process step in. The good news is that at another point in that process, at another site, that was identified, and when it was identified, it immediately triggered our process to stop, notify, and correct. So in the case of the other site where it was pulled out, it was identified. It immediately triggered our process to stop and make that pause and correct the issue. So we have added additional training and an additional process step to address this going forward. So while there's never 100% guarantee, I am exceptionally comfortable to tell the governor that we are in a good place to avoid another issue like this going forward. And we will continue to monitor and continue to do process improvement going forward. So I think hopefully that will answer that one question related to the continuity of government piece. Kenny, this is a balancing act, and we make recommendations to the governor to take care of our most vulnerable population, to maintain continuity of government and economy. And we have been focusing all of those essential worker and other activities at age 50 and above, because we know based on our data numbers that those are the vulnerable population and those are the people that go to the hospital. So I guess somebody else could make a series of other recommendations, and we could call those as good or better than what we have recommended. I just want to assure the people of West Virginia, we take this very serious. Clearly, the governor takes it serious, and I take it serious when I could take the uniform off today, and tomorrow I could go fishing. But I'm going to be here till the end, helping giving him the best advice possible and do the best we can. And we will try to make decisions that do the best and balance the approach to take care of the people of West Virginia.
Okay, and Kenny, coming back to the photo about, that circulated around about the Greenbrier, let's just call it what it is. I mean, the bottom line of the whole thing is it's a hit at me from the standpoint of a political hit at me. That's all there is to it. And primarily driven by, some Democrat senators, one right from our, from where the Greenbrier is located, it's basically just a slap at an employer that is employing 1,500 people with great jobs there. The next thing is just this is, where I was on New Year's Eve? I was laying in the bed watching the ball drop, rolled over watching, listening to J-Lo sing, and then rolled over when the ball dropped, kissed Kathy, wished her a happy new year, and both of us went to sleep. Now, the bottom line is just this: protocols are in place, and I will promise you to God above that the Greenbrier is absolutely following every protocol that you can possibly follow. You got to remember this too. There's 1,500 employees, and there's probably close to that in guests that are there, and they're spread out, and they absolutely are doing everything under the sun. Somebody is absolutely, without any question, going to do something somewhere to where somebody can take a photo and then try to trash people about it. I promise you, with all in me, if the Greenbrier is doing something that they're not supposed to do, then absolutely they will have me on them like stink on you know what. And absolutely with all in me, I feel the exact same way about any business in our state, any business whatsoever. We should follow protocols to the very best of all of our abilities, and absolutely we're going to have situations to where somebody can hide behind a bush and take a picture of 4 people getting on a ski lift that didn't know each other, But we all know how serious this situation is. From my standpoint, for God's sake living, I found out about this before, after you guys found out about it. I wasn't at the Greenbrier. I was at my house.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was hoping you could address the Saturday education map. Over the weekend, the Department of Education said they're not putting it out anymore. Could you talk about the decision not to put that out and how that factors into the decision-making we still have left to do before the 19th? Thank you.
Okay, Charles, as far as the map, not being out and everything, I think that was just for this weekend. But Charles, the Department of Education, they came to me, and there's another point that should be made here, and that's just this: is some people brought up the issue, says, well, Governor, if you can decide, for us to not have sports until March 1st, and so on and so on. Well, listen to me, that's not the governor deciding. The governor has to put his seal on it, but at the same time, where do these ideas come from? These ideas come from all across the sector. These ideas come from the Department of Education and our health experts and all the input that I can have and everything and do. From the standpoint of us playing sports and so on like that, we may very well look at March 1st as the game start date. And we may very well step back and look at conditioning and everything, but we know one thing for certain, don't we? We cannot be moving sports ahead of everything and absolutely starting back playing sports in 7 days. Do we not know that? The date was January the 11th. And so we pushed it out, and absolutely we can make all kinds of adjustments in regard to that. But that is absolutely, totally the decision of a lot of people. They made this decision as well, Charles. People made the decision that it was the very best thing we could possibly do to get our kids back in school. Clayton Birch, that was an absolute showstopper, and said to superintendents all across the state, as for the most part, all the superintendents were saying, we got to get back in school. This virtual stuff is not working, and we're failing our kids every way you can fail our kids. Now, from the standpoint of our map, to be perfectly honest, if we're going to go to school all across our state, from middle school and elementary schools, then our map really has served us as well as it possibly could to this point, and it has kept us incredibly safe in our schools to this point. But now we've got to keep moving and move on forward, and with maybe another technique level. And the map will serve us, in regard to our high schools, 15 and age and up. But our map really will not serve us now from our middle schools down. And I remind everybody that this still is an option to our parents, that they can either go to school or don't go to school, get their classwork online, and do it virtually. It is an absolute option from the standpoint of our county superintendents, as to what they choose to do, but it is our strong recommendation to go back to school.
All right, thank you, Charles.
Another thing real quick. Everything, as I've said it over and over, I don't know how many times I'm going to have to say just this, but our healthcare, community, our education community, all the science, everything in the world, everything tells us that we can go to school at the middle-age school and the elementary school level. And absolutely vaccinating our teachers and service personnel, we ought to be able to handle that. And I'll check, and we'll probably be using our DHH map instead, for our high schools as we go forward, but we'll check on that later too.
All right, thank you, Charles. Next is Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers, and this is probably more of a question for General Hoyer in regards to vaccine distribution, particularly to county health departments in regards to vaccinating residents 80 years old and older. But how are the allocations determined for how many of those doses are going out? And a quick example, Kanawha County, I think, had reported they had 500 doses for that age group this weekend. Wood County had 50, and Monongalia County had 100, I believe is what they had reported. And obviously, Kanawha County is a larger county by population, but Monongalia and Wood County are in the top 5 counties, and they got significantly fewer doses. And I know this is not an easy thing, and this is a balancing act, as you said, but how do you all determine those allocations for vaccines? Thank you.
Yeah, Stephen, there is a liaison, the GIADF, Dr. Keister, who works with the local health departments. And what you'll see until this levels itself out as we get the processes in place, there will be some probably what will look like generally to somebody uneven distribution. But at the time that we had the doses available and the governor gave us the approval and the guidance to move forward, at that time, Kanawha County had folks in place ready, and we'll go back and continue to improve and refine that. I think there were additional doses going out today to local health departments to stand up additional clinics. We know that people, as the governor pointed out, people over the age of 70 in particular are really interested in getting this vaccine. They know its value. They've been through the polio vaccine, and we will continue to get them out to them as quickly and as expeditiously as possible.
All right, thank you, Steve. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Happy New Year. Governor, for months you have asked West Virginians to pull the rope, to make sacrifices, to be very careful. And an example of that is student athletes who are delaying their sports seasons. That's just an example. I'm not necessarily specifying that, but West Virginians are asked to make sacrifices. So I wonder philosophically how you can address West Virginians who may see that video at the Greenbrier and think, is everybody pulling the rope here? And if not, why am I? Thank you.
Well, Brad, I don't know how to answer it. If you don't think I'm pulling the rope, then, you really got to screw loose. And every day I come in here and I try to come up with ideas like we got 8,300 seniors that would have never gotten those doses if I hadn't come up with the idea. From the standpoint of the Greenbrier, every protocol and every single thing, if you go there, everybody's walking around with a mask on. I've not been in the interim part of the Greenbrier Hotel for who knows, maybe a year, maybe longer than that. I'm not going to apologize to you for employing 1,500 people there and doing the work that we've done in lots of different places and everything. I can't tell you that the protocols are in place. The health department, I know, came before the New Year's, celebration. It is a hotel in which, you take in travelers from the standpoint of all the different activities that they have and that they do there. The health department came and they did everything and went through all that. There's people that are eating there, in every situation across this state. You can come up with something. You can come up with something somewhere. I'm not making any excuses. I'm not dodging any bullets. I'm telling you without any question, the Greenbrier of all places on this planet, over and over and over and over, I hear from people that have visited the Greenbrier and call me to tell me just how safe and how many protocols and on and on and on. And there are incidents of things that are happening there. They've done a good job. They've done a really good job. Could they have done better in this situation? Well, probably so. But with all that being said, I don't know the details. I don't know the stuff down in the weeds and everything. I surely wasn't there and everything. But to hit back at me about this, there's 1,500 people there. Is really the answer? Because, would it make you happy that if I said, well, the thing we really ought to do, just close it. Just close it. I mean, this time of year, they lose so much money, it's unbelievable. Just close it. It'll save me money. Just close it. Is that what you want? I mean, really, at the end of the day, from the guy that has come here and busted his chops in every way under the sun to try to help us and will continue to do so as long as God gives me breath. If that's what you want, that's not what I want.
All right, thanks, Brad. Next to Kimberly Keggy with WSAZ.
Hey, everyone. Good afternoon. I wanted to ask you, we've received a little more than 103,000 vaccines, but according to the dashboard this morning, only about 52,000 of those have been administered so far. So what is the plan with the other half that are still waiting to be administered? Thank you.
Is it Kimberly? Is that correct? Okay, Kimberly, let me answer this. I'll try to speed this up just a little bit and say just this. Kimberly, I want them all in the arms right now. And I can promise you that our National Guard and all the people, they're listening to me and they're probably sick and tired of me hollering. But really and truly, I'm not going to quit hollering. And they're doing the very, very best that they can possibly do. If you really look at that 103,000 is really counting, I think 16,000 are the second doses. They shouldn't be counted. You should really be looking at 87,000 and 51,000 that's been given as far as shots, 87,000 total. But we're going to get in another 20,000 this week. So we need to really, really crank it and everything. Now, if you look at us compared to the other states, we can sit back and say we're first or third or fifth in the whole country in getting them out. And that's great. But really and truly, Kimberly, the bottom line of the whole thing is we know this. Every single dose that we get out is a chance at saving somebody's life. And having 50,000 not out is absolutely something that we have got to safely be able to get them out, but we have got to push and push and push to get them out. That's all there is to it. It's a good question. We're on it. I mean, I am on this like you can't imagine because we got to get them out the door.
All right, thanks, Kimberly. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel, and Happy New Year. Some of the teachers are antsy out there about going back before their shots are completed, so to speak. Going from 50% to 95% seems like a pretty big deal to some of them, and I wanted to put that to you, Governor. What advice would you give them, saying that the 50% will be good enough to get them by, to get the kids back in school on the 19th of this month? And maybe the medical panel could weigh in if they have a 50% effective vaccine and they wear their mask, what kind of protection do they have? Thank you.
Well, Paul, here's the thing that I would ask. First of all, I would say, they were in school before. Now, I know that our numbers are much, much higher. I got that. But we were in school before, and now we're only increasing their safety level. We don't know of situations, I don't think, are very, very minuscule, very, very minuscule of situations that we have at levels below middle school, below middle school, or middle school and down. But the biggest thing I'd ask Paul is just this. What about the people that are working at the grocery store today? They go to work. They go to work, and they're protecting us all. They're not with just middle school and elementary school kids. They're going to work, and they're going to work for all of us. And they don't have vaccines that are going to protect them to 50 or 95%. They're standing in line waiting for the day when they'll be able to get their vaccine. And in addition to that, if that's not enough, the federal government through the stimulus package that's just passed is sending us another close to $300 million into the education arena to try to help make our schools even safer and safer and safer. Paul, I don't know what else we can do. If you can sit by, and I can't make it 1,000% safe. I can't make it perfect. Like I said, I can't part the seas or calm the seas. But if you can sit by and say, well, it's okay. It's okay. We're going to continue to try to educate our kids from a virtual standpoint, and we know a third of them are failing. Or we're going to absolutely just cast aside the fact that we need to keep eyes on kids, or we need to have special ed situations. We need to do things when all the science is telling us that we can go back to school safely. All the science, all the medical team, all absolutely the education people that are around me say, go to school, go to school, go to school. I can't make it perfect. For crying out loud, we have made it as safe as we could possibly make it in every way. And if you have naysayers, teachers unions that are rah-rahing people and everything, then let them rah-rah them. That's what I say. Just let them rah-rah them. I've made my recommendation as to what to do, and our kids need to be back in school.
All right, thank you, Paul. Next to Haley Kosick with Next Star Media.
All right. Hello, everyone, and Happy New Year. Going off of Paul's question, Governor, you mentioned earlier in today's press briefing that the next mission is to vaccinate all educators in the state. When would we like to accomplish this, and how soon, or is it too early to tell?
I was really, really hopeful that we could get this accomplished within 2 to 3 weeks. We're going to wait 2 weeks before we start. We're only going to start back on the 19th. I was really, really hopeful that by the 19th, we'd have everybody that would have taken the vaccine that is an educator or a service personnel person vaccinated by that date. And I'm going to still try to hold by that, and I'm going to still push like crazy to be able to get that done. It may extend another week beyond that, but I'm really pushing to get it done right now.
All right, thank you. Haley, next to David Beard with the Dominion Post.
Hi, I'd like to ask a question about the vaccines for the 80-year-olds and up. What I heard is just anecdotal. There was a couple reports of long lines at sites, people waiting more than an hour and being turned away without getting the vaccine. And I understand you've said that you don't have as much supply as you'd like, so I get that point. But I just wanted to address two things. Is what I've heard anecdotally kind of widespread, or were there problems with people getting turned away who are 80 and up? And if so, does it call for a tweak in the system, maybe going to an appointment basis rather than first come, first serve or something like that. Thanks.
David, I think we're doing that. I think we're trying to go to an appointment situation, but until we absolutely are really comfortable that we've got enough vaccines. But David, I keep going right back to the same thing. And these great people that are doing all this work, whether it be the Guard or the health departments and everything else, just think about this. Just somebody think about this. You know, the options are, well, we can study this and we can come up with a program and we can try to get it exactly right. And in doing so, let's say that takes an extra 2 or 3 weeks. And then we can appropriate vaccines and we can put some here and some there and everything. If we don't watch out, we're going to really get caught. And you talk about our butt in a ringer, we're going to really get caught and everything, because what's going to happen is you're going to hear on the door, and then somebody's going to say, you know, sir, we got a truck out here that's got 92,000 of these vaccines on it. Where do you want us to put them? Because everything we got's filled up. Well, I don't want to hear that. I don't want us filled up. I want them out. I want them out just as fast as we can feasibly do it. And General Hoyer wants that, and Clay Marsh wants that, Clayton Birch wants that, you know, Dr. Amjad and Bill Crouch, all of us want it. You know, but I don't want to hear this and say the cupboard is completely full and I don't know where to put them. I want them in people's arms. Now, with all that being said, we put 8,300. We've only got 78 or so thousand or 80,000 people in the state that are in excess of 80 years of age. And a bunch of them are in the nursing homes that we've already vaccinated. But we put out 8,300 people in the arms of our elderly people. Now, sure, there was probably somebody that was standing in a line, and the line, we didn't have enough. We just didn't have enough. Sure, there's bumps. But surely everyone has got to be able to see, of that 8,300, how many lives did we save? How many did we save versus sitting back and studying the situation, and then study it just enough to where you hear, and then somebody says, well, we don't even have a place to put them. And then the federal government comes right back and says, listen, West Virginia, you've got 125,000 vaccines that you haven't put in somebody's arm. We're not going to send you anymore until you get that down. Now, I don't want to hear that. I don't want to hear that at all. I want to hear, send us. I want them to hear me scream, send us more, send us more, send us more. Because that's what I think our people want me to do.
All right, thank you, David. Next to Jeanette Dill with the AP.
Hi, all. Yeah, Jeanette Dill with AP. Happy New Year to all. I wanted to follow up on the Greenbrier. Governor, I know you're saying the resort employs a lot of people, which is true. It's also true that a lot of businesses, small ones, they've had to close and greatly constrain their business due to the necessary pandemic restrictions. How is it fair to them that the Greenbrier seems to get off easier than, for instance, bar owners in Morgantown? And the video over the weekend showed a lot of people without masks. Do you condemn that? And how do we make sure venues like the Greenbrier are more stringent on that in the future? Thanks.
Well, let me tell you this. I don't want any special nothing for me. I never have. I never have in any way. Absolutely, without any doubt. Can you just think, just think through the process just a second. If you're working at the Greenbrier and you're in a managerial position today, and you know that if you get any little hiccup, it's going to cause some level of embarrassment to the governor, how really cautious do you think they are? Those people absolutely are breaking their neck to be as cautious as they can possibly be. Now, I don't know in the video, I don't know what happened. I don't know what happened. I've been told a lot of things from a standpoint that there was a balloon drop and a champagne toast, and a lot of people took their mask off for the champagne toast and whatever. I've heard a lot of things, but you see, I'm not telling you those things because I don't want anything to hide behind. If they had their mask off, they shouldn't have had their mask off, period. That's all there is to it. I'm sitting here telling you I don't want any favors. I never have in any way. I'm absolutely, I am so demanding on the Greenbrier and our businesses that they just listen to me at the briefing and do the right things. I mean, for God's sakes, a living. I don't go there, very, very seldom in the first place. And on top of that, I surely don't know what's going on at the New Year's Eve celebration when I'm laying in the bed at my house asleep. Now, with all that being said, if they're making mistakes and everything, then absolutely they need to absolutely experience whatever the negative, the wrath of what it needs to be. They need to get that and everything, because we don't need any favors. The Greenbrier doesn't need any favors whatsoever. And in the same way with all of our businesses across our state, we just need them to be as safe as they possibly can be all the time. But you've got to just remember this. At that location, on that day, like it or not like it, there's 3,000 people there. And they're spread out all over the place, and they're absolutely expected to stay all over the place and everything. I know the area and where the video was taken, that they moved all the furniture out of the area from what I've been told, so people wouldn't sit beside each other where the furniture was. Absolutely, without any doubt, it needs to always be better. But I've been asked this question now three times in a situation really and truly where we're putting emphasis on something at the Greenbrier Hotel because, to me, a person that wasn't even around whatsoever, because I own it. And what do you want me to do? What in the world do you want me to do? The only other recourse is say, from the standpoint of monetarily and everything, we'd be better off to close it. Is that what you'd really want? I don't really think that that's what you'd want for those 1,500 people that work there. Absolutely, from the standpoint, or say, would we be better off than to make absolutely certain beyond a doubt that we always are doing things to the safest in every way? Without question, we should. No question. This shouldn't have happened. This shouldn't happen. That's all there is to it. No matter what, it shouldn't happen in any business, anywhere, and absolutely, without any doubt, I'll promise you these people knew the protocols, and if there was something that was missed, it was just missed. I told my wife last night, I said, here's exactly what I said. I said, Kathy, if you were there and all of a sudden at the balloon drop, 50 people were taking their mask off, what would you have done? Well, here's exactly what she would have done and exactly what I'd have done. We'd have stepped up right in them and grabbed the microphone or whatever and said, stop. Everybody stop. Doesn't matter if it's a balloon drop. But maybe just somebody didn't do that, and it's a mistake.
All right, thank you, Junaid. Next to Dave Mistich with West Virginia Public Broadcasting.
Hey, Governor. Hey, panel. And I hate to belabor this point about the Greenbrier, but there's another question that I had that no one's really got to yet. Governor, would you mind to tell us the person that organized that event or that rented the space at the Greenbrier? And if you don't have that information, can you see to it that your folks at the Greenbrier that take care of that can provide that to me and the rest of the media if they're interested? And secondly, for the panel, particularly Secretary Crouch, Dr. Amjad, and Dr. Marsh, could you guys give your take on what you saw in that video and your reaction to such a large-scale event taking place? Thank you.
And was it Paul, Dave? Was it David? Dave, or Dave? I don't have the information. I don't have any idea. I have no idea. Who was the planners or put it all together and all this stuff. I don't have any idea, but I'll be glad to get you the information and supply you the information because, I'll call my daughter and she'll put the information together and get it to y'all because, I surely don't have anything to hide. And from the standpoint of Dr. Amjad, you guys weigh in on his question there.
Sure, Dave. I did see some footage online of the events at the Greenbrier, and like any events, over New Year's Eve, we do caution people to get together. I think some people in the videos, had masks on, some do not, but we do understand, New Year's Eve was people getting together. So anytime people get together, we do have, concerns. So we would just recommend if anyone got together during those events, if they have any symptoms of anything, to, see their doctors. But New Year's Eve was a time that we expected people to get together, but that those are recommendations. But we are aware of such events across the state and get multiple calls all the time. Thanks.
All right, thanks, Dave. Next to Joe Severino with the Charleston Gazette-Mail.
Yeah, hi. I'm going to continue on this too. A high school basketball coach, in response to this Greenbrier video, said it shows how hypocritical the guidelines in the state are, and that his kids can't be in the gym practicing while rich people can gather and party with no consequences, and that it continues a string of actions that affect the children more than it affects the adults for spreading the virus. What is response to his argument and parents who feel the same way?
I think it's Joe, is that correct? Joe, I would say just this, that from the standpoint of first of all, why do we need to pit one another against one another? I never have really been able to understand that. Why do we need to say, rich people? From the standpoint of those people there, if what they're doing there is wrong, they're just as wrong as the richest or the poorest or whatever people. It doesn't matter. It doesn't matter. We have had we still struggle with this. Is we don't need to pit union against non-union or black against white or rich against poor or whatever, Republican against Democrat. We don't need to do that in West Virginia, and we do it over and over, and it just doesn't make much sense to me. But from the standpoint of a kid, not practicing basketball, or from the standpoint of a coach, if you think, my God, if you think, well, Justice doesn't want the kids to be able to practice basketball. Justice is a basketball coach. Give me a blooming break. I want my kids to be able to play basketball more than you'll ever imagine. But it doesn't have anything to do with trying to connect with one another unless you, Joe, or somebody wants to make it that way. Really, at the end of the day, forget anything except just this. You have the situation that we have. To bring kids or to bring a game atmosphere with grandparents or whatever it may be inside a gymnasium, is that the thing to do today? It doesn't matter if they did something bad at Snowshoe or Greenbrier or wherever it may be. Should we do that today? We shouldn't do that. Evidently, we surely shouldn't have done what's happened at the Greenbrier. We shouldn't, we were all in here awfully concerned that Snowshoe was announcing that they're going to have 25,000 people there when they opened up and everything. And what should we do? Should we just say, nope, we're not going to do that. We're not going to allow that to happen. What should we do? What should we do at our hotels and our resorts across our state? What should we do tonight at Canaan Valley? When 1,000 people come, 1,000 people are there, and we separate and we do all the protocols in every way as best we possibly can, and things like this are going to happen. They just plain are, and this doesn't have anything to do with rich people. It doesn't have anything to do with the kids playing basketball or whatever. I want to play more than you'll ever know. Gracious goodness, do I want to play.
All right, thanks. Governor, I'll turn it back to you to close out.
Well, I could say, gosh, dog, I really think it's not fair and all that kind of stuff. But, in this in this job, I guess the thing that really, just echoes all around the place is just this, we expect our people and myself to do good, and then we can't really expect, that I guess the nice thing in exchange, that we come up with great ideas, we do this, we protect here, we protect there and everything else, and then we need a pass. We don't need a pass. I don't need a pass. That's all there is to it. I don't need patted on the back. I don't need told, how great we've done and all this. I don't need any of that. I don't need any of that. I'm going to continue to try to do the greatness as best I possibly can. And at the same time, if there's something wrong with somewhere in my neighborhood that or something that I own or whatever like that, then we'll get it straightened up. That's all there is to it. And so I don't begrudge the questions and everything, and it's just part of the job. And I'm gonna continue to do the job. That's all I've got.